which is just nuts. I'm sorry, it's just going by super fast, and it's like, and it's really mind-boggling to me just how little amount of time there is left before we can expect Squish to join our family. So that's just, anyways, still so much to do to prepare for her. Two kind of big things have happened since the last bump date. One of those things is the local Fleet and Family Services, like new parent support, had a baby shower. They have it once a year for the pregnant service members or their spouses, and it was really fun because I knew I wasn't going to have any kind of baby shower or blessing way or anything here, which I'm a little bit sad about. I really wanted a blessing way ever since I went to a couple. I thought they were really special. But since we're new to the area, don't know a lot of people and whatnot, I knew that was not going to happen. So that's exactly why they have this baby shower, is they know that most of the people here are not from here, that, you know, they might be missing out on having a celebration for their baby since they're far away from home. So it was really fun. We had some games that we played. We had some good food. There were like those little Smokies sausages and deviled eggs and fruit and veggies and little treats like cheesecake bites, and oh, it was just good. And you know, it was just fun to meet a couple of new people and just, you know, talk about babies and celebrate having babies. One thing we did, we had an activity where we designed our own onesies with puffy paint. I haven't used puffy paint since I was a kid, and it took me a long time to figure out what to do. I wasn't sure. But one of the other people at my, actually both the other people at my table made ones with their baby's first names. Obviously, we don't have one picked out yet, so I decided, why not her last name? So, Little Miss Taylor will be sporting this later. And then we also got just a little gift basket, just a few goodies. Thought was really cute. They had blue ones for the ladies having boys, and they had green ones for the ladies who either were keeping it a surprise or were too early to know what gender they were having. And it has a couple goodies in here. This folder has some information in it about new babies and the new parent support program and things like that. There's a little Elmo rattle, and a cute book, one of those Velcro swaddlers. These things are helpful. A little Ma'am pacifier, which I'm really happy about because these are the brand that were Kaladin's favorite, so they will probably be her favorite. And I swear, you're just always losing them and whatnot. I feel like you can never have too many pacifiers, especially when they're a little bit older and mobile. Some socks. And there's a couple, like, there's baby oil and a couple little samples of, like, Desitin and baby soap and stuff that I probably won't use. Because if she's anything like her brother, she'll have sensitive skin and not be able to use just anything. I'm going to just use the same stuff I use on Cal with her, which we use something called Scarlett's Naturals. It's really awesome. And there were these two onesies. There's just a plain white one, and this one, they were like tied in a little ribbon. They're really cute, but I just think it's so adorable. How cute is it? So it was fun. I had a good time. And earlier this week I had my latest appointment with Dr. Andrews, and again, he is awesome. This time there was a student doctor there with him, and the nurse asked me ahead of time if that was fine with me, and it was. The student measured my fundus, so I'm measuring exactly right on 33 weeks. He also did the Doppler, and he put it on, and that's where it was. Like, first try. It was awesome. He was really excited about that. Everything's looking good. Still nothing weird going on with my urine. Blood pressure's still about where it's been this whole time, so he's still not worried about that. I asked him a couple more questions. Like, I asked him if he knew what his, like, personal as a provider feedback success rate was. He said he has no idea, but it should be about what, you know, the average is 70 to 75%. I asked him about episiotomies, and he said he can't even remember the last time he did one. He did say years and years ago when he was first in training and starting as an OB that it used to be standard procedure, and but that's definitely not anymore. He only does it if it's really, really needed, but he hasn't had to do it in years and years. So I was glad about that, because I didn't want one just because, and I don't even want one if it's like, oh, you might tear. Like, I'd rather tear. So the only foreseeable reason I would want one is if, like he said, if I'm in the middle pushing her out, she's really, really close, and then she's kind of going into distress a little bit and we just need to get her out, he would do it just to get her out faster. Also, I think it's pretty standard if they're going to do forceps so that they can have more room to work with. But yeah, he was also talking about how he does perineum support to try to prevent tearing. He said sometimes moms who don't have epidurals don't like that and they say that it hurts, and so he tells them, well, do you want me to like help you not tear or not? He said, again, he told me what it's called, they keep forgetting. There's something he can do that numbs just that part so that he can do that, you know, stretching and support without it hurting, if I so desire. He also told me apparently a little known secret is there is one room with a tub in it at the hospital. He's seen it used once in 19 years by one of his patients. He's like, ask for that room. And he's like, and if they try to talk you out of it, say, no, really, I would like that room. So I really like that, because that implies that like I could get in it even with, you know, them wanting the continuous fetal monitoring. I would imagine either it's a wireless and waterproof system, or they would let me time off of it to get in the tub. Either way, I'm so happy that a tub is even an option at all, because that was a lot of why I wanted to go to that other hospital, because they have rooms with tubs. They will definitely be asking about that when I go on my tour, which is on the 4th. Anyway, he said that this next coming up appointment, which is 2 weeks from that one, is the last time that it's 2 weeks apart. So he said this is my last 2-week reprieve, and at that one we're gonna do the swab to see if I'm GBS positive or not, and he said after that it'll be weekly. And so that's just another thing, like, oh my gosh, it's getting close. And then he told me go forth and gestate, so that's exactly what I'm doing. She is just, I feel like I'm so huge now all of a sudden. Like, I can feel it just stretching, and it's getting harder to like move around. My feet and ankles are starting to get a little bit swollen, but I know that there's nothing alarming about it. It definitely was like gradual, and it's definitely slight. It's definitely no like rapid, sudden, crazy swelling. It's only a little bit of swelling. And it started like the same day I had my appointment, and there was nothing in my urine when they tested it. I took my blood pressure yesterday at the store, and it was 134/74, so it was actually kind of on the lower end of the little narrow range that I have. It's usually in the low 130s and sometimes high 130s, but usually around low to mid 130s over high 70s or low 80s. So being low 130s and low 70s, it was actually a little bit reassuring. I know some people would kind of be concerned with that reading, but that's what mine's been at, and it's on the lower end of where mine's been. He's not worried, so I'm not worried. I definitely trust his judgment. He doesn't seem like he's incompetent at all. He just doesn't overreact to things that are just variations on normal that are not really a dangerous issue, because obviously she's doing well. She's super active. I'm constantly feeling her think she's head down. I have no idea. I'm really terrible at belly mapping. I can't figure it out. It's really hard. And I'll even like feel something where I can just feel her, and I'll be like, what am I feeling? What is this? Is this a butt? Like, is this a knee? What is this? I can't tell. Sometimes she gets hiccups and I can't tell exactly where it's coming from to try to glean either. I don't know. In the meantime, I'm going to the chiropractor. That should help keep things aligned and ideal positioning for her to be able to get in ideal positioning. And if nothing else, it helps my back and hips hurt less. So that right there is a win in my book. But there's some tricks in my Hypnose Babies book and also on spinningbabies.com. I need to get better about doing them. I'm supposed to be doing the inversion every day, and I keep forgetting to do it. At least I know there's some options to try besides the external version. If she's still not head down, once we're getting towards the final stretch. I need her to cooperate because I'll be so mad if it comes down to doing all this preparation and having her not be able to even try for a VBAC. Because there's just not anyone here who is trained in a breech vaginal birth. So that's all that's going on for now. I have the labor and delivery tour and another meeting with my doula coming up on the 4th, and then my OB appointments the next day after that. Until next time, bye guys!